whether females should apply minoxidil. I wanted to talk about this to all of you since it is one of the commonest statements, rather question, which is asked by all my female patients. Doctor, if I have to apply minoxidil lifelong, why should I start minoxidil? I don't want to apply something which is to be applied lifelong. I would be addicted to it. I will not be able to leave it. So my dear ones, I want to tell you today that minoxidil is a medicine for female pattern hair loss. We are going to discuss this today in this video with all the females who have a question in their mind that if minoxidil is to apply it for whole life, why should I start minoxidil? Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon, and today we'll be talking about minoxidil and females. Now, if there is somebody in your family who wants a hair transplant done, but they want to see their result even before undergoing the surgery, I would suggest they do that in very quick 3 simple steps. 1 is download the Saraswat Hospital app. 2 is click on the PKI feature, take the quiz, and 3 is upload your pictures. You'll be receiving your result photos within 24 to 48 hours. These photos would have been reviewed by me or Dr. Satya sir. You'll be given a set of questions also which you can ask your hair doctor when you go for hair consultation. Also, we will tell you approximate number of grafts which may be required by you. Now hit the like button and let us dive deep into this question. Only yesterday, one of my patients asked me, Doctor, if I have to apply minoxidil for my whole life, why should I start minoxidil? The answer is that female pattern hair loss has only one US FDA approved medicine, which is topical minoxidil. Initially, 2% minoxidil foam was told to be used by the females, but now 5% minoxidil can also be used, and it is to be applied every day, 1 ml on the front and the top. And if some females are having hair loss on the vertex also, which is not uncommon, I must tell you, we see people who are having the crown hair loss also, they need to apply up till the crown. You do not need to apply above your ears or behind in the occipital area, in the donor area. The thing is that we eat food every day and we take medication for certain problems like diabetes or high blood pressure, or we take thyroxine hormone if we are hypothyroid. So there are a number of problems for which we take medication every day. Now, if there is one solution or one lotion which I need to apply just 1 ml once a day to keep my hair on my scalp, why shouldn't I apply? And the idea is that if you are fortunate enough that minoxidil is working for you, you should apply minoxidil. There are females as well as males for whom minoxidil does not work. Either they lack the enzyme, sulfotransferase enzyme, or the activity of minoxidil enzyme in them is very less. So they either need boosters or sometimes it will not help them at all. So if when you apply minoxidil and you have that paradoxical hair fall, which means after applying minoxidil for 10 to 15 days or sometimes 20-25 days, you keep on having hair fall, it means minoxidil will work for you. Why? Because minoxidil is letting the hair fall off, which were bound to fall off, and then it will make them grow in the longer hair cycle, the anagen phase. It will make them a bit thicker and make them stay longer on the scalp. This is what minoxidil does to your hair if you are sensitive to it, if you have good results with minoxidil. If you have any other question, you can write in the comment section below, or if you want to find out more about hair transplant, you can call us on the numbers below, or you can WhatsApp us your pictures, because hair transplant is sometimes required by females also. Hair loss in females can be due to multiple reasons. The most important ones are any nutritional deficiencies or hormonal imbalances. Apart from that, if we do a trichoscopy and we find out that the miniaturized hairs, the thinned out hairs, the very thin vellus hairs have increased in number, and we are able to see empty follicles also. So there are certain criteria for female pattern hair loss. So we need to find out the cause in you by a proper diagnosis, by various blood tests and trichoscopy, and then after you are diagnosed, we need to give you proper treatment. And if that treatment includes multivitamins, go for it. Minoxidil, go for it. PRP or growth factor concentrate, which is GFC, or mesotherapy, along with low-level laser therapy, along with derma roller, any such medical therapy, if your doctor suggests, then you should opt for it. Why? Because only then we'll be able to help you. If you want to see a full guide on minoxidil, you can click on the link above. The most important thing is that you need to have a proper consultation with your doctor along with your trichoscopy and blood investigations, and then have a long-term planning and treatment for yourself, because hair fall should be taken care of initially in the initial stages only. Later on, we may need certain other procedures if we have scalp show. In those cases, maybe we require scalp micropigmentation or a hair transplant in certain cases. What is good for you may not be good for other patients. So have a good long-term planning and treatment for yourself and stay cool. Please share this video with your friends who want a hair fall consultation or who are worried whether minoxidil should be applied or not. And also, if you want to see more such educational and testimonial videos, do subscribe to this channel. If you want to know more about hair transplant in a female, which is a non-shaven hair transplant, you should click the link on the right. And if you want to know a hair transplant testimonial of one of our patients, you should click the link on the left.